A healthcare trend important for parents with kids under the age of 5. Pediatricians are noticing kids under 5 who are infected with the Omicron variant of COVID-19 are presenting with symptoms similar to a common upper airway infection called CROUP. Dr. Kathryn Less is a general pediatrician at UW Health Kids in Madison, and she's seeing this trend in her practice as well, and she joins us now with more. Dr. Less, thanks for joining us.
Thank you so much for having me.
Of course. And so let's begin with the basics. What is CROUP?
Yeah, so CROUP is something that's caused by an upper respiratory infection, and that virus, typically a virus, and that virus causes swelling and inflammation of the upper airway, particularly the larynx and the trachea, so kind of like the vocal cords as well as the trachea or the windpipe. And that swelling and inflammation in that area is kind of what leads to that very stereotypical croupy cough. So something that sounds really barky, or kind of what we like to say a seal-like cough, in addition to your typical upper respiratory symptoms. So runny nose, congestion, that sort of thing. And we typically are seeing it, or we see it in younger children. So about 6 months to 5 years of age. And that's because their upper airway is just smaller. And as kids get bigger, their airway gets bigger, and that swelling and inflammation doesn't cause quite a significant interference with their kind of breathing and cough.
So those symptoms include, the cough, as you mentioned, but how are these symptoms different than COVID?
Yeah, that's a really good question. And so what we've noticed kind of over the whole time that we've been living with COVID is that the presentation has changed based on kind of how variants have changed over time. And so the hard thing about CROUP is that there really isn't anything symptom-wise that's different that you can just pinpoint. They're like, this is CROUP caused from COVID, and this is CROUP caused from a different virus, without testing for COVID in particular. And specifically with the Omicron variant, we've been seeing one of the typical presentations as the first symptom of COVID has been a CROUP-like illness.
Interesting. And so what's the biggest takeaway for parents if they want to protect their kids?
Yeah, so I would say the biggest thing to keep in mind is there's definitely a spectrum of how this virus can affect kids. Sometimes it's a pretty mild cough, upper respiratory symptoms, and can be treated like any other cold at home as long as the cough's not particularly bothersome. If that cough seems to really be giving your kids a hard time, if it seems like they're having a little bit of just becoming more uncomfortable, that sort of thing, definitely checking in with your doctor is important, because there is a medicine that we can give that brings down that swelling and inflammation. It doesn't make the virus go away, but it does treat some of the symptoms and the discomfort that causes the kids to be more uncomfortable. And I would say the biggest thing is looking at their work of breathing. So if it seems like kids are really working hard, breathing heavily, using extra muscles, or having something that we call stridor, which is a really kind of loud, noisy breathing, where it seems like the kid is having a hard time getting air in, those are things that kids should be evaluated for quickly, and most likely in the emergency room, because if you're already having a hard time getting that air in, those are things that we want you to, we've got some other medicines up our sleeve that we can use there.
All very important things to look out for. Dr. Less, thank you for joining us this morning.
Yes, thank you so much.
Well, still to come. The governor has ordered flags at half-staff today for a late state senator. We have more on that in just a moment. But first, let's take a look outside on the Green Bay Tower cam as well as the sun starts to rise. Stay with us at 6:45, and you're watching NBC 26 today. The last Afghan refugees have left Fort McCoy. This marks the end of a months-long mission for the Western Wisconsin Army base. Nearly 13,000 people evacuated after the U.S. pulled out of Afghanistan and were temporarily housed at Fort McCoy before being resettled across the country. And Governor Evers has ordered flags to be at half-staff today to honor former state senator Joseph Leon. He passed away on February 2nd at the age of 79. He was first elected in 1984 to the state Senate and served 10 years. He was then appointed secretary of the Wisconsin Department of Health Services, for which he served 6 years. Governor Evers said he'll be remembered for his commitment to bipartisanship, integrity, and his devotion to his family.
Wisconsin, what a warm-up we have gone through. High